One real consequence of Congress not passing a budget is an immediate increase in Medicare Part B premiums for seniors. The U.S. government just announced the largest hike in Medicare premiums since President Obama left office. Part B premiums will increase 14.5% next year. Now, in dollars and cents, that will take monthly payments for those in the lowest income bracket from about $148 to about $170. That's just $22, but still difficult for many recipients to afford. Medicare officials blame the pandemic for the hike. And last year, during the pandemic, Congress chose to limit the increases in the Part B premiums as part of a short-term budget. And Medicare now has to pay that back. Medicare is less than 60 years old, enacted in 1965. Before then, it was hard for black senior citizens to get quality treatment in the same facilities as white people. Because hospitals were segregated then, Medicare opened the door. And now black people make up 10% of Medicare beneficiaries. It has become a vital source of health coverage for people of color, many of whom are poor and sicker than their white counterparts. So keeping it affordable is indeed paramount. And joining me now is attorney Renee M. Landers. She served as Deputy General Counsel for the U.S. Department of Health and Human Services and as Deputy Assistant Attorney General in the Office of Policy Development at the U.S. Department of Justice during the Clinton administration. So good of you to join us this hour, Renee. I want to ask you real quickly about this very difficult subject that's so difficult for so many people to understand about Medicare. You know, Medicare has also blamed this hike on the new breakthrough of Alzheimer's drugs that has been outpriced for the people who need it the most. Talk about the impact of that, if you can.
Sure. Well, thank you so much for having me on the program this evening. I think that this price increase for the Medicare Part B premiums just illustrates some of the weaknesses in the Medicare program that that needs to be addressed. So, you know, as you referenced, the important hospital benefit for Medicare, that is definitely, you know, essential for seniors to have the confidence that if they, you know, have to endure a hospitalization, that the government will pay for the largest share of that. There is, however, a deductible that people are personally responsible for. And then Part B of the Medicare program pays for physician office visits, outpatient care, non-hospital based care. And the premiums, the charging this premium, was a decision that, departed from the Medicare Part A approach, which is funded by taxes on income while people are working. And so it really does involve people having to invest largely part of their Social Security retirement benefits to make these premium payments so that they can have access to health insurance for physicians and other outpatient care. And the average, just to say what this means for the average person, the average benefit for Social Security is between $18,000 and $19,000 a year. And so it's, we're not talking, really generous retirement benefits, and the Medicare premiums, those monthly premiums that you showed on the slide, will be deducted out of that, of these individuals' Social Security retirement benefits.
It's really an important a benefit to have, but yet it's so difficult to understand. I mean, people almost need a book to understand it, or they need someone like you with the expertise to break it all down in layman's terms of how vital this is. There's also Medicare provisions as part of the Build Back Better bill. In the meantime, what help is there for senior citizens who can't afford the increases that they're seeing?
So the Medicare program does have, special provisions to subsidize very, very low income seniors for some of these payments in the Medicare program, in fact, including not charging the premiums. But these are, the very lowest of the low income population, and then perhaps members of the population who, in addition to being eligible for Medicare because of their age or health condition, are also recipients of eligible for the Medicaid program. And so that there are provisions to deal with the very low income people. But I think, the Medicare program, just like some other private health insurance in the United States, relies a lot on the contributions of individuals for premiums for, Part B health insurance, for regular private health insurance, and sometimes with very high deductibles and copayments. Medicare Part B also comes with copayments. And so that is a challenge for people who are on limited incomes, in their senior years. The other thing I would say is that while Social Security retirement benefits are a really important component of retirement income for seniors, very large portion of seniors rely primarily on Social Security benefits for the bulk of their income. The benefits that we pay in the United States are low compared to what other countries that we like to compare ourselves pay for retirement benefits for senior, as a portion of of national income. So this is the United States, unfortunately, tends to underfund these programs, which therefore creates barriers to access to healthcare and all kinds of things for people. Because, even once you've paid your premium for Part B, then there may be additional co-payments and so forth that may discourage people or prevent people from actually obtaining care.
It becomes a problem indeed, and you're giving us some information, Renee, that can lead to some of the solutions. But we'll see what happens as well with the human infrastructure aspect of the Build Back Better program to see if they pass that. Again, thank you for joining us, Attorney Renee M. Landers, talking to us about the importance of Medicare. And again, it's good to have you on The World Tonight.